The nurses, doctors, porters, and other category of workers held placards as they lined the road leading to the health institution and threatened to strike if their demands are not met expeditiously. Mario Prophet, a nurse attached to the hospital's COVID-19 isolation unit, told Nightly News that the conditions which he and other colleagues are forced to work under is blatantly unacceptable.
We don't have adequate PPE because as it is presently we don't have shoe covers. 2 days now, and I made more than one submission to the Western Regional Hospital Administration, and all they're doing, they said that they're promising us most of the stuff that we write to the regional drugs fund, which is located here. Most of the stuff they're putting nil. So I think it's unfair for us to use our innovative idea and let the patient feel comfortable. The facility is not properly equipped, and also I think the facility is not properly conducive for work and also the patient well-being.
The X-ray system is down because lack of chemicals. Every now and then things are down for the X-ray system. We don't have enough protective gears. We're running out of masks when we go to the drugs. One does not have enough masks for us. Lack of supplies. We don't get stuff. Our condition is terrible at Western here.
Here's a yard attendant. In the yard, we got to get the closures, we empty the bin and things. When you ask the are you Holland, and now you get the virus, so yes, they say Holland, and let's not get it.
During the protest action, Vice Chairman of the region, Sheikh Ayub, sought to clarify that while the current stock of essential protective gear have not been totally depleted, it is inadequate to meet the demands of all staff. He, however, assured that items will be bought in a week's time.
Face masks and gloves will be provided shortly. It's not that there are shortage of face masks and gloves, but they are saying that 3 is not adequate for a week.
Ayub informed that the issue of risk allowances depends on considerations by the health minister. Earlier this month, subsequent to appeals from frontline workers, Minister of Health Dr. Frank Anthony had revealed that the government is considering a risk allowance for persons who are in the direct frontline. As such, the government has set aside a budgetary allocation of $150 million to support these workers. However, First Vice President of the Guyana Public Service Union, Don Gardner, is contending that the healthcare workers eligible to receive the risk allowance should not be handpicked.
All of these workers engage with the patients. The porters have to push them. The porters have to take them from point A to point B. The maids have to clean the areas. The nurses have to nurse the patients. The doctors have to prescribe the medication. And you're telling us because you're not in this area, you won't have it? You won't have the risk allowance? That's nonsense.
She noted that the distribution of the risk allowances should be negotiated with the workers. Dr. Anthony, during a recent interview in response to healthcare workers protesting in Linden on Wednesday, pointed out that there was no need for such actions. He stated that one of the immediate actions that were taken when his administration took office was to ensure frontline workers were equipped with the necessary personal protective equipment. The minister further stated that the $150 million which was allocated for risk allowance will be made available after the budget debate concludes.
Budget is not passed as yet. It's scheduled to be passed on Friday, and once it's passed, then we will have that money. And as soon as we get that money, we will be able to give nurses and other category of frontline workers.
Deputy Chief Medical Officer Dr. Karen Gordon-Boyle, when contacted for a comment, disclosed that she is not aware of any shortages of personal equipment.
So sometimes when people say they don't have, you got to ask the question, were they requisitioned on time? Because it may very well be at the central warehouse, but not at the site where it's needed. And there's so many different points along the chain where things could go wrong. So I'm not sure what went wrong.
Nurses at the Linden Hospital Complex in Region 10 on Wednesday staged a protest calling for risk allowance to be included in their pay packages. Another protest was carried out on Thursday. Temika Rodney reporting for the HGB Nightly News.